Today on why everybody says you should avoid Medicare Advantage like the plague. And if everybody had the opportunity, and I agree, if everybody had the opportunity, they would do a Medicare supplement, but that is unfortunately not reality. So let's talk about that today. All right. We are going to talk about that I could talk about Medicare Advantage, Medicare supplements, and the whole Medicare thing for hours and hours and hours, but obviously you don't have time for that, and I want to get to all the questions. So we'll talk about probably about 10 or 15 minutes on Medicare Advantage and the reality of the whole situation. And then I will go ahead and open it up to the floor for any questions y'all have. So make sure you type your questions in chat. And everybody, please press like so this goes out to more people. All right. Yeah, there's a lot of popular videos says avoid why I would never take I would never take Medicare Advantage, avoid it like the plague, yada yada yada. Um, and you know that's not reality. Insurance agents out there that help you sign up for Medicare Advantage and Medicare supplements and Part D and all the rest of it. And again, I put together a network of insurance agents throughout the country that can help you with all that. And because I saw too many people doing the wrong things, I figured I'd just go ahead and find people that are good and that could help you out. So if you need help, make sure you reach out. But insurance agents, okay, full disclosure, I'm going to show you how the sausage is made here. Insurance agents, they make more money when you sign up for a Medicare Advantage plan rather than a Medicare supplement, which sounds completely counterintuitive because Medicare supplement plans have a monthly premium. Depending on the state you're in and all those other variables, the average Medicare supplement, $100, $120. If you're in New York, it's 2 or 3 times that. And so it really depends on where you are. But there's a monthly premium, and it just covers the gaps that original Medicare, most of the gaps that original Medicare don't cover. They don't have Medicare Part D or any vision or dental or anything like that. It just covers those gaps, and it has a monthly premium. Medicare Advantage, most do not have a monthly premium. They are 0 monthly premium. And you're saying, okay, so when an insurance agent helps me enroll, and this is a free service, helps me enroll in Medicare Advantage because it's a 0 premium, they get less money as a commission. No, the opposite is true. They get more money. Everybody makes more money. The insurance company, the insurance agents make more money when you choose a Medicare Advantage. It's completely crazy. So that is the reality. And if you watch any of my videos, I recommend Medicare Supplements Plan N, which is the least expensive Medicare supplement, and the one that Medicare agents, again, including my network of partners, they make the less commission. The less commission on a Plan N, and then Plan G, and then Medicare Advantage. But it really depends on your particular situation. The whole health insurance thing is as y'all know, healthcare in the United States is a nightmare. Health insurance companies, when Medicare started in the 1960s, 1965, Lyndon Baines Johnson introduced Medicare. It was passed, and really wouldn't have passed if insurance companies, with all their billions of dollars, didn't want it to pass. But why did it pass? Why did Medicare even start? So you have to ask that question. But you have to look at it from the insurance company's perspective. So the government says, okay, we're going to do healthcare. Oh, wait, don't take over our healthcare. We're making tons of money with, selling people health insurance. Okay, all right. So what about if we give the elderly health insurance? Insurance companies, okay, wait a second. We can charge people premiums when they're in their 20s, 30s, 40s, 50s, but when they actually get sick because they're getting older, you'll take over and you'll pay for all that? And the government says, yeah. So they're like, yeah, sign us up. It's like a car insurance company. It's like, okay, there's like the government coming to auto companies and say, auto insurance companies and say, okay, you can go ahead and take premiums for this person for 20 years, but the day they're getting an accident, we'll go ahead and take over for it. The insurance companies were like, where can we get that? That health insurance Medicare deal. We like to get set up with that too. So yeah, the whole thing is It's a nightmare. And in not only 65, in 1973, Medicare also started making Medicare available to the disabled as well, and the insurance companies obviously loved that as well. So the whole industry, in my estimation, is complicated, frustrating, and all the rest of it. Okay, so um, if you don't have a Medicare Advantage plan, what can you choose? You keep your original Medicare Part A and Part B, and then you pick a Medicare supplement plan. Again, Plan N or Plan G are the ones that most people have available to them today. There's no HMOs, there's no networks, there's no pre-authorizations. With a Medicare Advantage, there's zero premiums, but you have networks, and anybody that's on a Medicare Advantage, you know, the networks change. One day your doctor is covered, the next day they're not, and you have to check to make sure, you know, you go into the hospital and you get, you know, this doctor does the surgery or something, anesthesiologist, turns out it's not a network, and it turns into a big nightmare. And pre-authorizations, all you got to do is watch the news sometimes, and you'll see all the issues with Medicare Advantage plans and pre-authorizations. With a Medicare supplement plan, you go to the doctor says you need X, Y, or Z treatment, and as long as Medicare covers it, you're good. Insurance company, nothing. They cannot say anything. Medicare Advantage plan, as you know, you go to the doctor says you need X, Y, and Z, and they said, I have to reach out to the insurance company and get permission to do X, Y, and Z. Even if original Medicare would cover it, the Medicare Advantage company can say no or delay, or, hey, doctor, you know, I know you're a doctor, but try this first. Or, and yeah, so if everybody, if it wasn't a price issue, because that's what it all barrels down to, it all boils down to, it's a price issue. If everybody, I believe, and put your comment in there, that I believe everybody would choose a Medicare supplement plan if price was an issue. Okay, so we'll talk about that. But my first preference, I mean, above all, rather than Medicare Advantage or Medicare supplement, in my estimation, my preference is original Medicare should cover all of it, rather than, like, right now, Part B covers 80%. So if you go to the doctor and have a surgery and it's a $100,000 surgery, Medicare pays 80% and Medicare supplement pays the other 20%, or whatever the case may be for a Medicare Advantage, depending on your particular plan. But I mean, why 80%? Why should it just cover 100%? So that's mine. So you wouldn't need any private insurance company at all. But that's my number one choice, is to have not having to deal with the insurance company supplement or Medicare Advantage. But unfortunately, that is not reality. So my second and third choices are Medicare supplement plan Ed would be my second choice. G would be my third choice. Again, if it works in your budget. A lot of people say, wait a second, okay, budget is really not an issue. And I can see this argument. So a lot of people that, you know, say they hate Medicare Advantage and they say Medicare supplement is the way to go, and it actually is going to be cheaper for you. Even though there's a monthly premium, it'll be cheaper. Why is that? Well, because Medicare Advantage charges as you go. If you get a Medicare Advantage and it's zero premium and you live for the next 50 years and you never really get sick, yeah, you've saved tons of money. You know, Medicare Advantage, 100%, that was the way to go. If you actually get sick, then Medicare Advantage charges you, you know, depending on your particular plan, your area and everything, they, you know, they charge you the hospitals, and they charge you co-pays, and they charge you co-insurance and all this other kind of stuff. With Medicare supplement, you pay the monthly premium, and then pretty much everything else is covered. There's a little bit annual deductible of $240 and N and G, and has a little excess charges. But watch my video. I just did a video about 3 or 4 days ago on the differences between G and N. So yeah, if you live the next 50 years and you never really get sick, Medicare Advantage, 100% the way to go. I don't think anybody can argue about that if they never get sick. But if you actually do get sick, then the nickel and dime and the pre-authorizations and the denials and the networks, that's a decision that you have to make based on your particular budget. So when people, reach out and comment and why do you talk about Medicare Advantage? Medicare Advantage is evil and yada yada yada. I said, well, it's nice that you were able to afford, the 100, 120, 130, $45, whatever, Medicare supplement premium above and beyond, because everybody still has to pay the Part B premium. So $174.70 this year for Part B, plus another $120. That's, $300 a month. And, the Part D and, whatever prescriptions they have to pay copays on, then, I'm so happy that you're able to afford that. But unfortunately, there are a lot of people in this country that just cannot afford it. And that is just the reality. And there's a lot of people that Medicare supplement just they're not available to them, because it's when you're 65 or you just start Part B because you were working for a while, you can sign up for Medicare supplement. No problem. Easy. You can't be denied. Medicare Advantage, you can sign up anytime. Again, most of the time is during, every year during October, November, December, during the enrollment period there. But it's difficult to switch from a Medicare Advantage to a supplement, because you have to have that particular eligibility, a special enrollment period, to get into the Medicare supplement. To go from a Medicare supplement to an Advantage, you can do that, every year, no problem whatsoever. And there's a lot of people that have different situations. If you're dual eligible, if you have Medicare and Medicaid, then a Medicare Advantage is, they have dual eligible plans, then I don't think anybody can argue that's the best one, because it zero premium and zero copays. And there's dual eligible plans built specifically for people with Medicare and Medicaid. Veterans that use predominantly the VA, and they just want a kind of a fallback, that they can, in case they have a second opinion or they're traveling or maybe they move in the future or something like that. So a lot of veterans that predominantly get their health care from the VA, Medicare Advantage, they prefer Medicare Advantage. The disabled under 65, in most states, they can't even get a Medicare supplement. So the only thing they have is available to them is a Medicare Advantage. When they turn 65, if you have a Medicare Advantage and you're, 63 years old and you're receiving disability, and that's the only thing you can get in your particular state, when you turn 65, you can choose any Medicare supplement plan. They can't deny you, they can't charge you more or anything like that. So, but prior to that, Medicare Advantage for most people, that's all they're available to. Employer plans, a lot of the retiree employer plans now are switching to a Medicare Advantage, and they pay for all of the copays and the out-of-pockets and stuff that the Medicare Advantage doesn't cover. So those plans are usually pretty good. So again, for people to make kind of blanket statements that, all this is terrible and all that is terrible, that's, again, yes, the whole system is terrible. But it's too confusing, and that's why I'm on here pretty much every day trying to, kind of let you all know about all your options for Social Security, Medicare, and all the rest of it. So please like and subscribe and share and all that kind of good stuff. But yeah, so I guess the best way is to, I guess make the best choice out of the worst options. I guess, yeah. So, and I guess, call your politicians and tell them you want, Medicare should cover the other 20%. I mean, we did it with Part D. It took us decades to finally get the government, Medicare, to add prescription drug plan. It's like, come on. Prescriptions are kind of important. That's, why isn't that in original Medicare? So it took decades and decades. And now Part D is part of it. They're still under, private plans. So, as I say in my videos, let's, add vision, dental, hearing, and then, it's our job to poke our politicians with a sharp stick and make them do what we want them to do. All right, but if you do choose a Medicare Advantage, I did a video on, I think I've got let me see here. Yeah, I did a video, how to get your money back from Medicare. I did that about a week or so ago, and it'll give you, you're not going to get a check back from Medicare, but I mean, you've already paid for all these services, preventive services and stuff like that. So that I talk about all kinds of different ways for you to actually get the money back. Because all this money for Medicare Advantage, You're saying zero premium. These guys are giving me health care for zero premium. No, 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 no. That's why the government says insurance agents can't say they're free, because they're not free. There's zero premium now, but you did pay for it. When you paid FICA taxes all those decades, that's where that money is coming from. That's your money. So go out there and make sure you get your money. Um, but yeah, I did one on the number one mistake people make with Medicare. And the number one mistake they do is when they have a Medicare Advantage plan, they don't check it on a monthly basis, or excuse me, on a yearly basis, because those plans change every single year. And you say, well, I like my company and, zero premium and it keeps my doctor. Yeah, that's the superficial stuff. But when you actually get sick, you go to the hospital and all of a sudden you get a, $400 bill and you're like, wait a second, this plan has zero. No, no, no. The plan you signed up for last year or 2 years ago had zero, but that plan is gone. They, like Cinderella, December 31st, it goes away and you get a new plan January 1st. And if you don't check it every year, then you're going to have some surprises. So check it every year and make sure you're in the correct one, and review your plan and your benefits. Medicare CMS has mandated that next year, 2025, Medicare Advantage companies actually have to notify you in mid-year, around, I guess, June or July or so, and send you a letter and say, hey, we're giving you dental, your plan this year has $3,000 of dental, for instance. We notice you haven't used it. Just kind of letting you know you still have $3,000 of the dental, because a lot of people have those benefits and they haven't been using them. Hey, I don't know about the gym membership one, but yeah, remind me. Yes, I should. Yes, I should go to the gym. Yes, you. So companies have to remind you. You have gym membership. You need to start going to the gym. Yes, I don't know about that reminder, but I guess it is a good reminder. So yeah, so that is good. Medicare is coming down on Medicare Advantage plans and saying, hey, you're giving out all these benefits. You should make it easier for the people to access, and you should kind of, make sure they know about it, because that's how you got them to sign up for your plan with all these cool bells and whistles and stuff. And so anyway, all right. Like I said, I can go on for another 6 hours on all things Medicare, Medicare Advantage, and all that other stuff, but I know y'all don't want to hear that. So if you are just here for the Medicare, Medicare Advantage, and why you shouldn't sign up, again, it's all completely your decision. If Medicare Advantage is the only thing in your budget, then more power to you, and it's a beautiful thing. But keep up on it on a yearly basis to make sure you're getting all your benefits and you're with the best plan, because your company in your area that accepts your doctor, there's probably, in that same company, has 2, 3, 4, 5 plans, and they've updated yours, but they haven't updated yours. They've come out with a new plan, an XYZ Medicare Advantage 2.0, but you're on 1.0, and that's slowly becoming more expensive when you actually get sick. And the 2.0, that's a lot. They're trying to entice people to enroll, and so they make it a lot of cost savings in there, a lot more benefits. But you're like, oh, I like mine. I'm not going to do anything, and you're going to pay for, essentially, when you get sick, you're going to pay for all the benefits the new people that signed up for the new plan in your company. So again, you have to check that on a yearly basis to make sure you get everything you paid for. Again, zero. It's not zero premium. It is zero premium, but you've already paid for it. So, all right, let's go ahead and go into lots of questions. So if you're just here for the Medicare and you don't have any questions, make sure you subscribe and like and share and all that kind of good stuff. And that way, when you do have questions in the future, you know how to contact us. All right, let's see. Lisa. Oh, the May the 4th be with you. That's right. Oh, yes, that's right. It is Star Wars Day, isn't it? All right. That's right. I completely forgot about that. May the 4th be with you as well. So one pays $174 for Part B in addition to Plan N or et cetera. That is costly? Yes, yes. A lot of people, when an insurance agent signs you up for whatever, they are supposed to read that to you, that you understand that you still have to pay for Part B, whether you sign up for a Medicare supplement, NG, Medicare Advantage, whatever the case may be, you still have to sign, you still have to pay for Part B. Most times it's taken out of your Social Security check if you're currently receiving Social Security. Um, the only way you don't have to pay for Part B is if someone else pays it for you. That is the Medicare Savings Program. If you apply for Medicaid or you're on Medicaid, you can be on Medicare and Medicaid at the same time, but they have a Medicare Savings Program where the state Medicaid offices will pay for your Part B. So there's millions of people like that that have Medicaid pay for their Part B, and that's a beautiful thing. And the only other way is there's some Medicare Advantage plans, depending on your area. Um, I always like to say that because Medicare is clamping down on, all those commercials where they say, hey, there's, free ice cream and unicorns for this Medicare Advantage plan. Call us up, and you call them up and says, yeah, I want free ice cream and hundreds of dollars of this, that, and all this other kind of stuff. And they say, well, it's not available in your area because that plan is only available in like one little part of the country. So it's kind of a bait and switch. So Medicare is, clamping down on that, which is it's a beautiful thing. So too much, too much hype and BS. But yeah, so the only other way you can get out of pain is if someone else pays you, and there's a Medicare Advantage plans called Part B give back or buyback. Usually a lot of veterans, people that go to Native American hospitals and stuff that get most of their coverage from then, and they don't need a lot of health care. So, but they want kind of a fallback. So they sign up for this Medicare Advantage plan, zero premium, and the Medicare Advantage plan pays all or part of their Part B premium. So again, it depends. Not sure if it's available in your area, but if you want, give us a call, email me, and I can find someone in your area to check and see what is available in your particular area. Okay, I sent you a phone number a few weeks ago. I needed more info about your person that supports your channel. I wasn't able to reply back. All I have is my phone. Not real good on that. Okay, just send out again. You're looking for someone to help you with Medicare plans or something like that. Yep, just go ahead and reach out again. Email me, call, leave your name, phone number, the state, because these are all state specific, and what you're looking for, and I will find someone that can help you out. Let's see here. Hi, Ed. Thanks for all the good information. You're welcome. My husband's employer has a plan that has a lump sum HRA for medical upon retirement. Can that be used for premiums or just expenses? Yeah, that's that is more of a reimbursement. So that's more of a tax type thing because you're going to get the money, and so I would. And all those plans are written up differently. Sometimes they won't. You can't use that money to pay premiums. So I would call your HR and find out whether you can actually, because you're getting the money. I don't know whether you have to submit receipts once you pay it. So the first time you submit a premium receipt, they might kick it back. So I would definitely reach out to them and find out. And let me know. Yeah, come back here and let me know. I like to see what kind of, general coverage throughout the country. How old do you have to be to get Medicare Advantage, or when do you need to get on it? I am on Medicare right now. So if you're on Medicare right now, then right now, because original Medicare Part A and Part B is awesome. You go to any doctor in the country that takes Medicare. You don't need pre-authorizations. If Medicare covers it and the doctor says you need it, you're done. But yeah, if you have Medicare, then you've got a lot of gaps. The biggest one is that Part B. So Part B covers, again, your doctors, but it only covers 80%. So you're on the hook for the other 20%. So if you don't have something, either a Medicare Advantage plan, a Medicare supplement plan, or Medicaid, then yeah, you definitely need to find something to fill those gaps. So again, you can give us a call. and I can find something for you. Free/lower cost dental for over 65 and retired. Yeah, I've got a company that I use. It's in the description, so it's super easy to look for plans, so you can check that out. There's also I don't know if you watched the let me see if you watched the video I did on living on Social Security alone. I've got a four-part series. I did a four videos on living on Social Security alone, and it talks about all kinds of different programs that might help you out. And yes, the introduction on video one was way too long, and I apologize. Just skip through it. But um, if you have a dental school in your neck of the woods, reach out to them. They're always looking for patients for their new students to, you know, practice on, but they're all under, you know, supervision of actual, you know, full blown dentist professors and stuff like that. So usually get really good service because it's, you know, they really check. And there's super low cost or free. And there's also, you can contact your state like dental association, and there's usually dentists that do some type of bunch of free service and community work and stuff like that. So yeah, I would definitely check out that. But you know, if you're looking for just a regular insurance, dental or vision insurance, I've got it in the link. But there are other places as well. Yeah, Hoover plan in $400 a month in New York. Yes. All right. So that is because I believe New York is doing it right. And what do you mean by that? Is um, Obamacare, Affordable Care Act, Marketplace, whatever you want to call it. They cannot deny you for pre-existing conditions. If you know, have some type of illness, they can't deny you. Medicare Advantage can't deny you for pre-existing conditions. You know, you can be as sick as you want and still get Medicare Advantage. They can't deny you. Medicare Part A and Part B and Part D, they cannot deny you for pre-existing conditions. Medicare supplements can deny you. If you're outside of your, you know, you're that 65 years old, or you just recently started receiving B or something like that, they can deny you. But New York pretty much says, no, you can't. So New York gives a lot more regulations to make it easier for people to get Medicare supplements in New York. And there's a lot of people that, you know, live in, you know, Texas or Florida or California or wherever the case may be, and they get sick and they really want a Medicare supplement because they want to go to the doctor they want to, and they don't want all the, you know, copays and pre-authorizations and all that kind of stuff. So there are some people that just move to New York and they can get a Medicare supplement. And because of that, all of that, that's why New York is crazy expensive. If every state did that, which I believe they should, then it would level out, and then all states would, you know, be a lot better. So I think the government should come down and, you know, say, and particularly for people with disabilities. Same, I just talked to a mother and daughter yesterday, and they would love to get a Medicare supplement, but she's 30, 31, sorry. And yeah, she can't get a Medicare supplement because she's disabled. And in her state, you couldn't do it. So either move, unfortunately, or yeah, just get Medicare Advantage. And then when you turn 65, get a Medicare supplement. And I mean, my personal opinions are flowing out here. People on disability, they can get Medicare after being on disability for 24 months, which is, in my estimation, stupid. Because why? And if you're 65, you get Medicare. So once you know, get disability, I think, you know, people on disability, you know, they need medical care. So why should they have to wait 2 years if they're approved for disability? I think they should get Medicare immediately. But again, that's, you know, as I always say, once I become an enlightened dictator, that's the second thing I'm going to do, is make those changes. And the first is always cure for male pattern baldness. But anyway, let's see here. My SSDI cons exam was held this week. I can't tell if it was totally favorable on my behalf as it was very tough. It was 45 minutes. The doctor mentioned COPD and asked me to fill out a form. Is that a good thing? Yeah, so you have the CE, the consultative exam. So that's good. So that means Social Security looked at your records and your medical records and decided, well, okay, this definitely needs to go forward, but we don't have the specific information we need in the medical record, so we need to send this person out for a consultative exam. And so that's good. So that means it's going forward. That's always a beautiful thing. And whether, however that doctor writes it up, and yeah, it's nobody knows. Nobody knows. So at least everything is progressing along. Yeah. Dr. Weir, which supplement plan is cheaper, G or N in California? N are usually cheaper throughout the country. California is strange. I mean, it's California. They don't call it Medicaid. It's Medi-Cal. Yeah. So, but California actually has Um, there's companies there that you've got the birthday rule that if it's your birthday, you can switch to a Medicare supplement or another plan. And California has some strange regulations, but good regulations, good regulations. So it's sometimes easier to get a Medicare supplement plan in California. Um, and I don't think in California, I don't think if you smoke in most states, you usually have to pay a little bit more for a Medicare supplement, but I don't think it's so in California. They can't ask you that in California. But N, traditionally throughout the country, it depends on your particular area, but N are usually cheaper. And everybody thinks, and myself included, that N's price increase over the years is going to be less than Plan G, just because Plan G it's kind of the new Plan F. It's a guaranteed issue. It's easier for people to get than N. They're all again all difficult-ish if you're not 65 or new to Medicare Part B. Yeah, N looks to be cheaper going forward, cheaper now and cheaper going forward. That's why I always recommend N to begin with, and then a super, super, super right next to it, close behind is a G. So my sup plan offers a free gym, some vision coverage, and a few other freebies. I have not joined the gym yet. Yeah, they just started doing that within the last year or so. Yeah, it's not really vision dental coverage as in insurance. I'm seeing a lot of those plans. I know which one you're talking about. That same company also offers Medicare Advantage plans, and they have networks, and because they've had they offered gym membership with their Medicare Advantage, they decided to add that as kind of a perk and stuff. But it's not traditional insurance like a Medicare Advantage has dental, vision, hearing, and a lot of those plans. A Medicare supplement, they say we have dentists. We're not going to give you like insurance, but you get discounts of those dentists. If you use one of our dentists, we've made deals with them, and so you can use them and you get discounts. So it's not really traditional insurance, it's more of a discounts. But hey, saving money is saving money. It's a beautiful thing. All right, potato potato, right? If on a G plan, what is the max out of pocket for hospital? As I understand, there are no copays. If you are in a G plan and your hospital and your surgery is $1 million, your deductible for that year is $240. So yeah, that's it. That's why people love the G plan. Yeah, it covers everything. It covers the the $1,600 and change for every time you go into the hospital, which could be multiple times a year. It covers the after 60 days you have to pay more for the hospital. It covers that. It covers the 80%. The only thing it doesn't cover is the one-time annual Part B deductible of $240. So if you got $1 billion bill, you pay $240. That's it. With a Medicare Advantage, they've got max out of pocket, and it really depends on your area and everything. I've seen max out of pocket for the year being, close as low as $600, $900, $5,600. But that's per year. So if you get sick in December and you go to the hospital, they could charge you, 1,000, 2,000, 3,000. And then if you have to go back in January, the whole thing resets again. So you have to, and that's usually, unfortunately, the nature of the beast. That's when you get sick is, on the weekend or at the end of the year. So you have to repay everything the following year. Yeah, you restart the clock. Lola, what's up? I want to know if once we get original Medicare, which we pay the 174, is that supplement Medicare? Because I'm confused. No, so that's called original Medicare. Everybody calls it original Medicare Part A and Part B. Part A covers your hospital, and then Part B covers your doctors. And so when you're 65, you sign up for Part A, which is zero premium, and you signed up for Part B, which is the 174 you're talking about. But then you have all those gaps that you are responsible for. So that's why people get either a Medicare Advantage plan or a Medicare supplement plan. Again, it really depends on your particular situation, whether you can afford the monthly premium for the Medicare supplement plan, or all the rest of it. So if you want someone to help you out on all that, just reach out and we can have someone give you a call. Angel, any idea how the SSDI calculates your benefit amount? Yes, it's based on how much you actually paid into Social Security. So, so they do with regular retirement. It's based on your high 35 years of earnings. But if you're younger, 40s, 50s, and you didn't have 35 years, so they base it on that. So basically what you pay into Social Security. And you can look at, go into ssa.gov, set up an account, mysocialsecurity.gov, an account, and it'll tell you exactly in there, at 62, here's a projection. At 67, here's a projection. And then if you become disabled, here's how much you could receive. So how to apply to get 800 plus debt card for expenses. Monthly amount gets reduced. What is that? How to apply 800 debit card for expenses. Are you talking about those grocery cards and flex cards and all those? Yeah, that's another thing that the government Medicare is clamping down on, which is a good thing. I think that's what you're talking about, where they advertise, hey, on Facebook and stuff, hey, you can get, we can get this $500, cash card or grocery card or, whatever, $1 million for dental and whatever. And then you call them up and they'd say, yeah, it's not available in your area. So, but there are places in the country that do have grocery cards, and, the dual eligible plans usually, again, depending on your area, have a lot more bells and whistles, usually, but again, it really depends on your particular area. All right, all the HSA plans I looked into did not allow you to use the money to pay premiums with. Okay, good information, thank you. She had written HRA, health reimbursement, so health savings account. The HSAs, you can't really pay the premiums with that, but HRA, so again, that might be something offered by her particular company. And if it's offered, take it. Disability, does it also qualify for supplemental under age 65? It depends on your state. Yeah, so again, that's why I talk about New York. Some particular states, I don't have the full list here, but give us a call and we can find out. But again, you can be denied because of what happens is, first of all, the states doesn't mandate the insurance companies to offer it at all for people under 65. So not all states even have it. So if you call up or call us up or whoever, call up your insurance broker and say, hey, I want a Medicare supplement, and they say, well, we live in Arkansas, like people yesterday. then yeah, no, no, sorry, nothing. And some states you call them, oh yeah, 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 we've got it, but it's like 5 times more than than if you were 65. So yeah, so I think all the states should kind of get together and do like New York, a little bit better, and some of the things California does. But um, yeah, but if you're on a Medicare Advantage, that's the only thing you can get. Once you turn 65, then I would definitely, kick around a Medicare supplement. Again, it's not for everybody. It really depends on your budget and everything. Um, oh, let's see, Phyllis, I get reimbursement from my HSA for Medicare premiums. Okay, all right, good deal. Yeah, so that's why I always hesitate on those. Yeah, they're all written up differently. Which states, if any, are in particular Medicare supplement friendly with lower premiums? Um, Medicare supplement friendly. Um, are friendly in the sense of, yeah, they're all friendly when you turn 65 or you just received your Part B card. If you're 70 years old and you had health insurance from work, yours or your spouse's, and then at 70 years old, you stop receiving health insurance from work, and then you go ahead and sign up for Part B, then you're golden again. You can sign up for any Medicare supplement plan and they won't deny you. They can't deny you. But yeah, yeah, they're all 50 states and they all do something strange. California is easier to get into, and yeah, so Texas is, yeah. So um, let's see. Government wants you to sign up for Medicare Advantage, then you off their responsibility. Well, that was kind of the intention. That's why Medicare Advantage hasn't been around for too long. Um, but yeah, that was the intent, is for the government to save money on original Medicare by moving that over to private insurance companies that could manage care. And by manage care, which is a euphemism for you're denied, right? Managed care. It's like, okay, the doctor says you need this, that, and the other, and the insurance company said, no, no, you don't. So that's what kind of, managed care. And there's a HMO, health maintenance organization. It's like, it's better. I agree. It is better to kind of do the preventative stuff. It costs a lot more money to spend some money up front rather than getting sick later. That's why in my video I just did on the one I just showed about get your money back from Medicare. I hope you never get your money back from Medicare Advantage, or any place, because that means you were never sick. And just like car insurance, I never hope you get your money back from your car insurance, all the hundreds of thousands of dollars you paid in car insurance over the decades. I hope you never get your money back from there, because if you do, that means something terrible has happened. So, but if you look at all the research recently, you can Google it and read all the detailed reports. All of the Kaiser Family Foundation and all these entities have done. It looks as though Medicare Advantage plans are costing the government more than if they would just stayed on original Part A and Part B. So there's that. Yeah, the original intent was to save money, but it looks like that ain't happening. Insurance companies have power in Washington? Huh, who would have thunk it? All right, thanks for all your help. All the people needing help. You're welcome, welcome. You're welcome. Let's see. Plan G offers a high deductible. Yes, yes, I forgot to mention those. Thank you very much, Lisa, looking out for us. A high deductible option for less dollars. Are any other supplement plans expected to do that soon? I probably can't afford an Advantage. Yes, there are high deductible Gs and things, some Ns, but yeah, most time people can do a high deductible G, because there's not much difference between N and a G. Again, check out my a video on the differences between those. But yeah, there's high deductible ones that basically say, okay, like, okay, this is not an actual example. Let's say a Medicare supplement G is $150. Okay, just throwing some out there. But a high deductible, which means it's a high deductible, that means you have to pay the $240, but you also $3,600. You pay the first $3,600, and they pay the rest of it, or the first $2,000, whatever the case may be. So that's a high deductible. And those, a regular G is 150, but a high deductible one might be $70 or so. So yeah, some people get the high deductible. But with Medicare supplements, again, Medicare Advantage, you can change, particularly in October, November, December, you can change to any Medicare Advantage, from one Medicare Advantage to any of the dozens and dozens and dozens of Medicare Advantage in your particular area. But that's not the case for Medicare supplements, including, again, depending on your state, including high deductibles. If you have Plan G high deductible with company X, Y, and Z, and do that high deductible thing for a while, and then say, "Oh, it looks like I'm getting sick. I don't want to pay those high deductibles because I'll have to go to a lot more doctors next year. Yada yada yada. I'll go ahead and switch to the regular G." No, insurance companies, come on, they don't get to be $1 billion insurance companies by being stupid, right? Like the old Richard Pryor. Don't get old to be by being stupid. Anyway, all right. A lot of people answering other people's questions. So that's a beautiful thing. I like that. I read about someone not being able to suspend their rib after being on disability because they said he never applied for retirement. They refused to stop the automatic conversion. Yeah, there's a lot to unpack there. Not being able to suspend their retirement benefits after being on disability. Okay, so I did a video a little while ago about that you can, once you hit your full retirement age, everybody in the country that's on disability, once they hit their full retirement age, they're automatically switched to retirement benefits. So you're on disability for 10, 15, 20 years. You reach your full retirement age, you're no longer on disability, you're automatically switched to retirement benefits. Same benefit amount, same payday, and all that kind of good stuff. But because now you're on retirement, you can actually delay retirement and get voluntary delayed retirement credits. And I don't, maybe, as I mentioned in that video, that's a policy that a lot of Social Security employees don't even know about. So that's why I included the policy reference, the PALMS reference. The PALMS is 20,000 pages plus of regulations that Social Security employees have to go by when they adjudicate a claim. And most of them don't know about this voluntary delayed retirement credits. So that's why in the video I did on that, I actually put it down there. That way, when you walk in the office and you talk about it, you can show them the policy. Most of the people in the front windows are lower level employees, and they probably never heard about it before. So when you go into an office and say, "I want to do this," they'll probably say, "Yeah, you can't do that." And then people think that's the official Social Security decision. No, you have to actually set up an appointment and see a claim specialist that specializes in retirement. So took my son to the local Social Security office to get my son his Social SS. The lady at the booth processed it and then gave us paperwork to take to PennDOT for a state ID. PennDOT didn't accept it. Should they have? So yeah, you probably just received no. I know what you did. Again, I ran the third busiest office in the country, and we processed more Social Security cards than anybody in the country. So, well, except for the two offices in New York City, we were third busiest on that one too. Sometimes we were number one, but anyway, you just got the receipt. So I assume you're talking about a SS. You're talking about a Social Security number. So your son got a Social Security number, but he didn't get the card. Yeah, you can't use. They won't accept the piece of paper that you actually applied, because applying means nothing. That means you applied, and whether your son gets a Social Security number, that will be determined when he gets a Social Security. Obviously, he will. It just sounds like it's just a replacement card, because most people get their Social Security number when they're born. They get it at the hospital. EOB, as they call it, enumeration at birth. Yeah, still remember all the crazy acronyms. But you just have to wait the 7 to 10 days to get the Social Security card in the mail, and then you get the Social Security card and then take it down there. So there's that. Joe, my employer will pay $1,500 towards my Medicare, but it looks like they jacked up the SUP plan about $20 more. than what I can find in my area. Can they do that? Yes. So when you sign up for a Medicare supplement plan, the prices are not going to stay the same forever. Um, there are different pricing models, community, and then when you actually enroll in a supplement plan. So in all the states would do it a little bit different. But they can all, Medicare supplement plans can all raise the price based kind of like on, I guess, medical inflation. Um, and if you get like community pricing for your Medicare supplement plan, it depends on your particular area. So if you live in an area that has a lot of elderly and a lot of sick people, then those prices are going to rise more than in an area that has a lot of young people and, young, 65, 66, 67, under 70s and stuff. Um, like saying that. Yeah, young people in their 60s. We're all young in our 60s. All right, let's see some TikTok questions. My mom just turned 100. Wow, holy cow. And is living only on Social Security. Had to move in her with me. Well, congratulations on your mother living 100. Tell her congratulations. And number two, that you are there looking out for her, and that is awesome too. So it's nice to have kids that step up to the plate. Um, in the old days, before COVID and everything like that, you would have gotten a visit from the local Social Security representative, the field rep, and they would have come out there and given your mother a certificate. It was called the Centenarian Project. And so congratulations from Social Security for living 100 years old and stuff. But part of that was Social Security, as Congress mandated Social Security to go out there and visit people that are 100 years old to make sure they're actually still alive. Because you see it in the newspaper all the time that, the person passed away 5 years ago, but there's checks are still going out there. So that's why we had to send someone out to those houses, those homes, and say, "Hey, how you doing? Congratulations!" And the most important thing, we're just checking to make sure you're still, your son or daughter hasn't done anything terrible with you. So, but yeah, check out my video again, the 4-part video on living on Social Security alone. And I've got like 48 different programs in there that might help you and your mother out. And speaking of one, is another question here. What is the requirements for the Medicare Savings Plan? Okay, awesome. Yeah, so the Medicare Savings Plan, again, that's through the state, so it's Medicaid. So you have to be qualified for Medicaid. And before I worked for Social Security, I worked for social services doing Medicaid. But they're all kind of state, a little bit different, a little wonky in different states. Some states will give you Medicaid, pretty easy. Other states, anyway. But yeah, you have to file for Medicaid, and then there's income limits, and resource limits. If you got to get in a whole bunch of money, or got a bunch of money in the bank, then yeah, you wouldn't be able to get Medicaid. But call. As always, I always say with all government programs, apply. All they can do is say no. So call Medicaid, your social services in your state, and have your mother apply, or this is a different question, sorry. But yeah, apply for Medicaid, and if they approve you, then the state Medicaid will pay for your Part B premium. And you have to look at it again, almost everything is driven by money. Medicare Advantage, Medicare supplements, and it's all money driven. Follow the money. The states have determined that if it costs them $10,000 a month to take care of someone in their state, or they can pay $174 for the premium for the government, the federal government, to pay for it. And they're like, yeah, well, that's a no-brainer. So we'll just go ahead and pay this person's Part B premium, and then most of the costs will be covered by the federal government. So that's why the states do that. So there's that. So call social services, call your state Medicaid, and definitely file. Is my mother committing fraud in New Jersey, collecting my deceased father's Social Security benefit? He passed in 2007. No. Um, hey, speaking of in New Jersey, I just got contacted by an old Marine Corps buddy that saw me on. So hello from New Jersey, Matt, old Marine Corps buddy. But no, yeah, no. If that's what Social Security survivor benefits, if she was, um, if they were still married, and they were married at least 9 months, then yeah, she would be entitled to survivor benefits from his record forever and ever and ever. If they were divorced, as long as they were married for 10 years, then same situation. She could collect on his benefits as survivor forever and ever and ever. Going to be 65, best year to retire on employer insurance. No retire. Best, yeah, best year to retire. It's so many variables. In terms of collecting Social Security, 65 is not the full retirement age anymore. Yours is probably what, 66 in 10 months or 67 or something. Um, but so you're still limited in the amount of work you can do. You know, because you're going to be taking early retirement. Once you hit your full retirement age, then you can work and make as much money as you want, and nothing gets withheld. So yeah, a lot of people, that's the big debate on social media and everywhere, is you can see in all the comments, oh, you should take it at 62, and it's, don't give it back to the government, and get while this getting's good, and all this kind of stuff. Well, yeah, if you need the money, you're not working over the annual earnings limit, longevity in your family is a big decision as well. I did a I did a little short, and it was kind of a little dark humor, sarcastic, whatever. But there is one. If you tell me one date, if you give me one date, I can tell you 100% for sure when you should retire, when you should start your retirement benefits, whether you should start at 62, 65, 67, 70. You give me one date, I can tell you 100% for sure the best time to retire. And everybody probably knows the date I'm talking about. Tell me when you're going to kick the bucket, when you're going to shuffle off your motor coil. If you give me that date, I can tell you 100% for sure. Oh yeah, then you should have definitely filed at 62. Oh no, no, you should have waited till 70. But since you probably don't know that date, it's all crapshoot. You just make your best guesstimate, and you know, hope you live for 100 till 150 years old. So there's that. Let's see. Uh, if I take Social Security at 63, then become disabled, can I switch to get Medicare early? No. Um, you can't switch like that. If you file for Social Security at 63, retirement, I'm assuming, and then file for disability, it depends on when they determine your disability date. But when you're on disability, you have to wait for 2 years to start Medicare. So if you're 63 now, the soonest you would start at 65 on disability for Medicare is, and you would already start because of your age. But if you were 62 and you file for disability and retirement at the same time, which you can file for both at the same time, then yeah, you would get a year early. But in your case, if you're 63, the soonest, again, but if you file for disability and Social Security determines your disability started a year ago, then yes, you would start it early at 64, because you've technically been on disability for a year. Or if they find it, here's what a lot of people happens, they file for disability and they file for initial and reconsideration and a hearing, and it takes them years, and then they finally get approved, and then the next day they get their Medicare card in the mail, and it's like, wait a second, I thought I had to be on for 2 years. Well, technically you have been on for 2 years. You just, it just took Social Security and everybody 2 years to figure out you were disabled. So yes, so there's that. Afi, what's up? Can one stay on Medicare Advantage, although not FRA, and no longer receiving SSDI? Yeah, it really depends on a lot of situations. If I'm going to have to do a deep dive on that one, but if you were kicked off of SSDI because of work or something like that, usually you can keep your Medicare for, I think it was like 96 months or something like that. So yeah, reach out. Medicare Advantage, you can keep Medicare Advantage as long as you have Part A and Part B. So as soon as you lose Part A and Part B, then you can't get Medicare Advantage. You have to have Part A and Part B in order to get Medicare Advantage. So it figures in with A and B. So there's that. So yeah, when you lose your disability at 60 at your full retirement age, um, it's not a big deal because now you're getting Medicare based on retirement rather than your disability. Yeah, I'm having a hard time with TikTok because I've got to do it my little camera here. I need 10,000 subscribers so I can see y'all's questions better and I can broadcast my little, notes and all that kind of stuff. TikTok requires me to have 10,000 subscribers to do y'all correctly in live, so I apologize. How do we get a caregiver for the family from Medicare in New Jersey? Yeah, it really depends on if you have a Medicare supplement or Medicare Advantage. But either way, uh, get a prescription from your doctor. So yeah, it's just like a typical drug prescription, but you get a prescription for the person needs a caregiver this many hours a week, and then you submit that to whether it's Medicare directly or through your Medicare Advantage plan, and they will make the decision. All right, Kim, what's up, Kim? Can ex-spouse still use my record if he married and then years later divorced? Yes, yes. So if yeah, if you were married to that person for 10 years and then they got remarried and then their benefits probably stopped from you and then they got divorced and then yes, they can still go back and restart it again. Yes. Let's see here. I took my okay, I got that. Oh, I took my Social Security at 63. If I switch to widows at his full retirement age, all that be fuller discontinued. Okay, so he took his Social Security at 63, and if you switch to widows, his full retirement age doesn't matter. So when you take widows, his retirement age doesn't necessarily matter. It matters on how much he gets, and then you will get. Um, he took it as widows at full retirement age. Yeah, so yours will be reduced now based on your age. So if you're 60, well, depend. You took it at 63. You're on 63. Okay. So if you're full retirement age, you're going to get 100% of what he was receiving. So super long story short, now that I think I might understand your question. So I don't think I understand the second part of it, but basically how it works is I did a couple of videos on survivor benefits, but um, if so he took it at his full retirement age. Yeah, so if you get at your full retirement age, then yeah, you're gonna have 100% of what he was receiving. So let's see. Yeah, yeah, your mother is not committing fraud by receiving survivor benefits. Yeah, again, unless they were never married, then that might be fraud. If they forge the marriage certificate or something like that. But no. Is there a benefit to delay drawing survivor benefits? Okay, good question. Yes and no. Yes, possibly. Um, the longer you wait to receive survivor benefits, the more money you're going to get up to your full retirement age. But with Social Security, there's an exception to exception to exception on everything. It's crazy. Um, there's called a thing called a rib limb. You probably see it on the internet called a widow's cap. If your spouse, your ex-spouse, the deceased spouse filed for early retirement, Congress decided, well, that might not be enough for the surviving spouse to live on. So rather than do the full reduction like your spouse, we'll give them 82.5%. And it's a crazy calculation that nobody can figure out if they don't have internal access to your record, to your deceased spouse record. So if you're 62 and a half, I would call Social Security and check and say, hey, I want to file a claim for survivor benefits. And because that is the only way you're going to find out what the exact numbers are in this particular case. Other cases, you can, it's easy to do calculations, but in a survivor case, if you know that your ex-spouse took benefits at 64, 65, 66, then you should be good. But if you don't, then I would definitely call Social Security and run the numbers and have them say, okay, give you an official number, and then say, okay, if I wait a year, how much is it going to be? And they'll say, okay, it's going to be 1,300 this year, but if you wait till next year, it'll be 1,500. And then at that time, you can tell them, okay, all right, cool, I'll see you next year. And they're not going to give you a hard time. They're going to say, oh, you wasted my time. No, they're going to be very, very happy that now they don't have to take your case back to their office and adjudicate it. So you've just given them 5 minutes back in their life. So yeah, you just say, okay, all right, we'll see you next year. Bye. And then hang up the phone. So, all right, let's see here. What other kind of questions you got? How do you earn the credits the Social Security office says you need? By working or self-employment or whatever the case may be, and paying into Social Security. This year, a quarter of coverage is $1,730. Yeah, so if you go out there and earn $1,730 and pay FICA taxes on that, then that is a quarter. Hello, is there a period of time to apply for survivor benefits? My sister died 2 years ago. Yeah, so the spouse, no, the spouse can file anytime as long as they're 60 years old or older, because you can't file for survivor benefits until 60, unless you're a disabled widow or widower, and then you can start at 50 years old if you're disabled. Are survivor and widow benefits the same thing? Yes, yes, yeah. Widow is specifically, for the spouse, but survivor benefits could also be for children. So surviving children and surviving spouses and stuff like that. But it's pretty much, yeah, they're used kind of interchangeably. My parents got married when I was 5. They divorced 8 years later. Is my mom entitled to survivor benefits? Unfortunately, no. She would have to have been married 10 years in order to get those benefits, unless, well, you said they got divorced. So yeah. So if they were married when the spouse passed, 9 months is enough. But since they got divorced, unfortunately, no. So, all right. That office says 174.70. Yep. So somebody's helping out somebody else. I like it. All right. It's been over an hour, and I think we've done enough damage for one day. We've answered a bunch of questions, and hopefully TikTok is getting me closer to 10,000 so I can treat you all right. Oh, we got another question here. McFact, hey, what's up? Can one walk into a Social Security office and ask for a future appointment with a claims specialist or anyone at a higher level than someone at the Social Security window? You can, but you can only do it like 3 months in advance, because they can't take anything earlier than that. So what you have to do is kind of play the system a little bit, because most offices won't schedule an appointment unless there's actually a claim there, because all the offices are completely inundated and they're just overwhelmed. So they don't want to waste the time of the actual claim specialists on, going through things that, people just have, unfortunately, questions and stuff. I know it's a terrible system, but it's the only time, the difficult one is that rib limb and the widow's cap. That's such a crazy difficult calculation. It's hard to figure out. So the only way you can get a definitive number is by filing a claim. Anything else, how much your retirement is going to be in the future and how much spousal benefits. I did a video on spouse benefits, how to calculate that, just regular spouse benefits. And in survivor benefits, generally, if you wait until your full retirement age, you get 100% of that person's benefit. So, but again, if that person filed way, way early, you're actually going to get a little bit more. So, all right. Sarah says, thank you. You're welcome. That girl says, Love your life. Thank you. I appreciate it. Appreciate it. All right. I think for today, and y'all have an awesome weekend, and y'all take care. Have a great one.